In this video, we are going to discuss the conduct of the randomized clinical control trial using the protocol. And we start about the basic steps in the conduct of randomized control trials. Is that the first step is to draw the protocol, and the second step is selecting of the reference and experimental population, and then randomization or random allocation, and then manipulation or intervention, and then we have follow-up, and then the assessment of the outcome. As we can see here, we have the reference population from which we carry out random selection of the experimental population, which is the population that will be randomly allocating to the group which will receive the new treatment or the treatment group, and the other group which will be the control group, which will be for comparison. And the outcome, as we can see here, is that among those participants in the first group, in the treatment group, there will be some who improved, others who did not improve, and as well within those who received the current treatment, some of them will improve and others did not improve. So the protocol is one of the essential features for the randomized clinical control trial, that you have to carry exactly, you have to indicate exactly what are you going to do in this trial. So the protocol, this is the special essential feature for the clinical control trial. That is mean you have to include all these details which will reflect exactly the steps that you are going to follow in the conduct of the clinical trial. The protocol specifies the objectives, definitely, the selection criteria, the inclusion and the exclusion criteria, the sample size, technique and estimation, and the procedure of allocation of the subjects into experimental and the control group, in the sense that how are you going to allocate the treatment group and the control group, how they are going to be randomly allocated to each group. And then the treatment or the intervention applied, how it is going to be applied, where and to what types of patients, and the details of scientific techniques and investigations that you are going to carry out. And once the protocol has been evolved, it should be followed strictly, and you should adhere to it throughout the trial. There is no way to carry any sort of adjustment or modification. So now we talk about the selection of the reference and the experimental population. And here, when we talk about the reference population, it is the population to which the findings or the outcomes of the trial, if found to be successful and fruitful, are expected to be applied. And then we have the experimental population or the study population. And we mean that population is derived from reference population, and it is the actual population that participates in the trial, and then it should be randomly selected from the reference population so that it will be representative for the reference population. Otherwise, if the study population is not randomly selected, then we cannot generalize the results which will come upon after we finish the trial. If the study population differs from the reference population, it may not be possible to generalize the findings or the results of the trial for the reference population. So it's very important to ensure that the population is representative, and then we come to talk about the random allocation later. The participants or the volunteers in the trial should fulfill the following criteria. They must give informed consent, and this is an ethical requirement, and they should be representative of the reference population as well as eligible or qualified for the trial according to their inclusion and the exclusion criteria which have been specified for the trial. Randomization or random allocation is a statistical procedure by which the participants are allocated into groups, usually called the study and control group, or the treatment and the control group, to receive or not to receive the experimental or therapeutic procedure or the intervention. And this is very important to ensure that the participants are randomly allocated, and that in the sense, if randomization aims to make the groups comparable, and if randomization has been performed correctly and properly, chance is the only explanation for any observed difference between the groups in the outcome of the trial. And randomization ensures that the investigator has no control over the allocation of the participant to either study or control group, and thus we can easily eliminate the selection bias. And this is very important, as most of the coming steps for the trial will depend on the allocation and how it is performed, to ensure that we have selected them randomly, in the sense that in any participant, whether to be included in the control group or the treatment group, this should happen by chance. There is no way other than this. That should happen randomly without any sort of intervention from the investigator or other team members of the trial. And every individual should have an equal chance to be allocated to either group, as I've just mentioned. We have several types of randomization schemes. That simple randomization, and this is analogous to a related, repeated fair coin tossing. Each new assignment is independent, and the advantage is that each assignment is completely unpredictable, in the sense that in the long run, number of participants assigned to each group should be equal. However, there is a risk of imbalances between the treatment group and the control group, that there will be some sort of reduction of creativity and statistical power if we carried out the simple randomization using this approach or this technique. The other thing is restricted randomization blocking, and done to ensure equal balance of arms throughout all portions of the study. For example, we have blocks of 6 would have 3 active and 3 control, and block size itself can or should vary to ensure allocation is proper. Stratified randomization, and here individuals are identified based on the important covariates such as gender, age, occupation, and the randomization occur within the strata. The essential difference between a randomized trial and analytical study is that in the latter, there is no randomization, because differentiation into cases and control, for example, or exposed and non-exposed, have already taken place. So we remain only with the only option for us is to ensure comparability in analytical study design is matching in comparison to the randomized trial, where we can carry the random allocation to allocate the individual equally into experimental and control group as well. The manipulation or intervention, as it's called, is usually done by application or withdrawal of the suspected factor, for example, a drug, vaccine, dietary factor, or dietary regimen. This manipulation creates an independent variable, which is a drug, the vaccine, or new procedure, whose effect is then determined by the measurement of the final outcome, which constitutes the dependent variable. For example, the incidence of disease, the recovery, the severity of the disease, etc. And then we talk about the follow-up, which is very important, and this includes examination of the study and control group subjects at defined intervals of time in standard manner, under the same condition, in the same time, in the same procedure, using the same frame up to the end of the final assessment at the end of the trial. And this is very important, is that we have to follow a standard manner in the follow-up to examine the same investigations that we are going to carry for both groups in the same manner and at the same time. This is very important. And the main difficulties encountered in the follow-up is that attrition is an important factor, the death or migration, displacement of loss of interest by the participants. The final step is the assessment of the outcome of the trial in form of positive results. And this includes benefits of the experimental study or the trial, such as reduced incidence of the disease or severity of the disease, as well as the cost of the drug or the intervention, so that at least we care for the affordability by the individuals in the future or the patients in the future. So we talk also about the negative results or the negative outcome, including the severity and frequency of any side effects or complications or any problems that arise for the individuals during the course of the trial. The incidence of positive and negative results is compared in both groups, and the differences are tested statistically using the standard test of significance to ensure that they are to ensure whether they are significant or not, and this is very important still. Thank you very much.